Welcome back to today's podcast episode, everyone. I've got a very, very special guest for you guys today. For those of you just joining, we're E.N.G Media, and today I've got Jackie with me, a healthcare executive, board advisor, and entrepreneur with over 30 years of experience across 3 continents and health systems as well. So, Jackie, thank you so much for joining us on the podcast today.
It's my pleasure, Tyson. Thank you for that kind introduction.
Absolutely. And I know that Dr. Ramon Lizardo had actually connected us after our podcast episode together, and he was telling me about your very unique story. So maybe we can start there. I know you've got years and years of experience in the healthcare space specifically, but where did it all start off for you, Jackie? Like, where did your journey really begin?
How much time do we have? So, my journey began as a teenager who had asthma, living in West Africa, where you could get care from your local pharmacist, and you didn't have to pay. You just had to pay for the medication, right? And so I got intrigued by the way medications act to help you be able to breathe. So if you ever seen an asthma patient use an inhaler, they use the inhaler, they're struggling to breathe, they use the inhaler, and boom, it's like magic. And
Right.
I wanted to understand, how does a drug do that?
Right.
And that's how I ended up going to pharmacy school. Went to pharmacy school really young. I was 15, and I went back and I asked my mom, why did you let me go to college? I was so young. She said, you were ready. Unlike my brother was 16 and he looked like the kid. And I was like, I was younger than him. You let me go to college? And she was like, you were ready. He's not. Uh, so finished pharmacy school just before my 19th birthday, practiced for a couple of decades, and then transitioned into doing other kinds of work. And I know we'll have questions around that in a minute.
Yeah.
But after about 20 years of pharmacy, it was time to do something else. The US healthcare system encompasses a lot more than pharmacy. And so I wanted to know more, do more. And so I had an inflection point where I expanded and went to do something around really enterprise-wide work, implementing new laws across the whole enterprise
Oh,
when
well.
I worked at a health plan. And after doing that for 5 years, it was time to do something else. You'll notice the trend here. And then after doing that for 5 years, being the only non-attorney on the senior leadership team of the general counsel of a large healthcare company, I decided innovation was really exciting, as it is. It's hard, but it is exciting. And I took a role as vice president to be in charge of transformation right at the start of the pandemic. Literally got that job in April of 2020. And so
Oh,
the
wow.
world was changing at that point. And rapidly, like I was told, if you want to get something done, you give it to people who are already busy because they're getting stuff done. And so I rapidly got a lot more added to my plate and ended up being responsible for health equity, responsible for virtual strategy. Again, makes sense. We were in the middle of a pandemic. Responsible for clinical data strategy, and also responsible for the healthcare innovation.
Oh,
So
wow.
that's the truncated version of 30 something years.
Yeah, I mean, and it's so interesting how from such a young age you went into pharmacy school specifically. I think you said from 15 to 19, and then it seems like throughout your career you've really chased innovation and like really pushing yourself and pushing the boundaries. I mean, you make it sound easy, but I'm sure there's a lot of hurdles that you've had to overcome, not only in your career, but just with taking the situation into context, especially taking over digital transformation during a time, COVID, where it was kind of new. I feel like for a lot of companies, not only in healthcare, but really in general as well. So, my question for you is, what's maybe one of the biggest obstacles that you've had to overcome, both in your career, but also in your entrepreneurial journey up to this point? Like, I always like to dive into our guest's story, like the good, the bad, and the ugly. And, you've had a successful career up to this point, but have there been any obstacles that have really shaped kind of who you are today and how you live your life and really just operate overall in business?
So one of the things I forgot to mention, and I should have because it's really important, is that this is my third country, my third continent. And so I wouldn't call it an obstacle. I would call it an opportunity to grow, to be versatile, to be adaptable.
Love it.
So moving from, I was born in the UK. My parents are of Nigerian origin,
Oh, wow.
and my formative years were in Nigeria. So I went to school in my grade school and college. I went in Nigeria, and then
Mm,
I moved back to the UK as a very young adult. Now here I am. I'm a British citizen, but I'm really a stranger in the country of my birth because Nigerian accent, Nigerian culture and upbringing with some British flavor, I'll say, because the Nigeria it was a British colony. And
yeah.
so that was one of the bigger obstacles. It's okay, how do I learn how things are done here? With a pharmacist license, it didn't work in the UK. I had to go through the whole I didn't have to go back to college, but I had to go through the whole process of getting my license and all of that. And just as I was settling in, it was time to move to the United States. Not going to get into details of that, but I moved to the US about 6 months after I got my pharmacist license in the UK. And somebody asked me very recently, what was harder? That was last Friday. I took a walk with a friend, and she said, she's born and raised in the US. She
Mhm.
said, which was harder, moving to the UK or moving to the US? And I said it was moving to the US because even though sub-Saharan Africa and Nigeria and England are very different,
Mhm.
it was a British colony. The words you use to describe things are the same. I literally felt like I was learning the English language all over again, even
Oh, wow.
though that was my first language. So you have to figure out what's a cupboard and what's a wardrobe and what's a closet. And I had to learn all of that. All the drug names were different. I had to learn all of that. And I was a little bit older. I was in my 20s. I wasn't
Mhm.
5. It's easier to assimilate when you're younger. So that was the hardest part. I think that was harder for me. And then, of
Yeah.
course, I had to get my license all over again. So those are major life inflection points, right? Moving
Yeah.
from country to country. Those are certainly big. The other thing I think was challenging was moving out of my comfort zone. So after 20 years in pharmacy, working in different aspects of it, I was an expert. I was a deep expert. And the teams I led had pharmacists on them. And so if anybody had a different opinion, I was knowledgeable to subject matter level expertise. But when you move and you now lead a team of varied professionals, which I think is essential in your growth as you ascend the ladder and you have more and more scope of responsibility, you
Mhm.
now have people working for you who have other expertise. That is an opportunity for growth for you because you learn from them.
Mm,
But it also puts you in a position where you are not the most knowledgeable person on that team, which is the ideal team, to be frank. Because if you're the
yeah.
smartest person as the leader of your team, then you didn't hire correctly, right?
Yeah.
And so I had accountants, CPAs reporting to me. I had an attorney reporting to me. I had a product expert reporting to me. I had a variety of teams under me, and they were opinionated, and that's exactly how I liked it.
Yeah.
Because I don't like docile teams. I like to build synergy on my teams, and I like to look at us and say, what expertise are we missing? And let's hire for that.
Yeah.
So, but you have to be a really strong leader to be able to be challenged, to allow yourself to be challenged and to not to be dictatorial
Mm,
where nobody has an opinion because they know Jackie's going to shoot it down because she's not open to opinions. I welcomed that interaction. That makes
yeah.
it just that little bit harder, but it gives you better outcomes.
100%. Yeah, I appreciate you sharing those insights into leadership. I'm early on overall in my entrepreneurial journey, so it's interesting to hear you talk about how you can learn something from your team, and ideally, you want to have people that are smarter than you that are working with you, so that way you can kind of learn from them instead of taking more of a dictatorial standpoint on operations. And that kind of leads me into my next question as well. When it comes to healthcare innovation, how would you say like clinical operations can make or break the actual innovation within healthcare? Because it's interesting to me. You've spent over 30 years in this space now, and especially, post COVID, what would you say are some key things that you've noticed in how clinical teams operate and how that kind of makes or breaks innovation in healthcare?
So as a word I found out yesterday, maybe I knew it, maybe I didn't, but it's called automaticity.
Mm,
I'm probably saying this wrong. Automaticity.
mm,
It's the ability to automate. It's the reason why you can navigate to your house without thinking about the roads and whether I turn left or turn right. Your brain is just wired. It knows how to do that. And it reserves energy to do the more complicated things.
mm,
The same thing happens at work, whether you're in clinical operations or not. There are just some things you do a certain way, and then you don't have to think about it. So when you bring innovation or you're changing things, which could lead to better outcomes, you are actually moving people's cheese. You're
Mm,
stopping their brain from going into that autopilot and just doing it the way they've always done it. And now they have to think about what it is they have to do differently. And
yeah,
people resist that change because it makes things slower to begin with. So
right.
previously I was able to go 1, 2, 3, 4, 5, and I got it done and I didn't really have to think much about it. Now it's going to be 3 steps, but I have to think about every one of those steps because you gave me a new system
Mhm,
and I don't quite know how to use it as much as this tool I used for 11 years, as an
right.
example. And so that becomes really the barrier. It's the barrier of adoption because there is a valley. People are performing at this particular height. You
Mhm,
bring in new innovation. If you don't, you need to plan for it to kind of somewhat tank. It
mhm,
will, the rate of production or output will drop. And you have to keep people supported through that period of time for you to finally start to realize the gains that you expected for this technology, and then you go back to where you were before, and eventually you'll surpass where you were before. So
yeah,
clinicians are challenged, and other people, we're going to stick to clinical operations folks. We have all these great ideas about how we're going to change the way we do healthcare today, because yes, there is waste in the system and there's an opportunity to be more operationally efficient. One of the challenges, because I work with healthcare startups a lot,
mhm,
right? I'm a board advisor to 2 or 3, and I'm looking at another 2 or 3. And
nice.
there are great ideas out there about how we can improve outcomes, improve access, reduce costs. What we have, though, is we tend to have people creating these tools and these services outside of the healthcare environment without walking side by side with folks who are inside of the environment. And so they've built something that looks great
Mhm,
until they talk to somebody who's actually operating day to day, hour by hour in a clinical operational workflow, and they
yeah,
haven't considered what it's going to take to incorporate or embed this new product or service into a system. And
mm,
so that's what I've really been doing in my last 5 years. It was embedding healthcare startups into legacy systems, systems like payers who pay for healthcare for the majority of Americans. If you have this wonderful idea and this great tool, but it cannot plug into that system, it will not reach scale, and therefore it will not get the desired outcomes. And
yeah.
that part is really challenging. It's really as simple as that.
Yeah, 100%. I think you have a really unique perspective when it comes to embedding a lot of this healthcare technology into more of like legacy systems, kind of like you'd mentioned as well. You'd shared an example with me the last time that we spoke of what that kind of looked like early on. I think it was like over 10 years ago at a previous role that you were part of. If you remember that conversation, could you maybe bring that example to light on this podcast specifically? I think you had mentioned that you were writing the new protocol essentially for a company that you're working with, their technology team. Does that kind of ring a bell from the last time that we had spoke?
Yeah, except it was more than 10 years ago.
No. That was my mistake.
That's okay. It's okay. I'm dating myself. So it was Medicare Part D.
Okay.
And I think what I did was I showed you the textbook where I wrote the code that we
Yeah.
built into the system. Yes, yes. So when Medicare Part D was put in place, I was part of the team who helped to implement it. And we had been doing our work, which was utilization management. We had
Mhm.
been doing it by Outlook. We were using Microsoft Outlook to send the letters, to look at the data. And now CMS required us to turn things around a lot faster than we had in the past. And so now we realized we needed a system, and we decided to do a homegrown system. And so here I was reading, and the folks who know Medicare Part D from way, way, way back, we know that there was a chapter called Chapter 18. And that wrote the rules on what you needed to. Actually, it wasn't that explicit, but it told you what you had to do and what you couldn't do. And so I had this technology guy who was building the system and literally would read the chapter 18, and tell him what it is we needed them to build.
Oh,
Now,
wow.
CMS didn't tell me exactly what we needed to build, but they
Mhm.
told us what they expected. And so I was literally the subject matter expert telling him what I needed my system to do, and he would build it right away, and then CMS would change their minds like 2 weeks later.
Oh my
But it
gosh.
was it was really interesting to see that grow. And after maybe, I think maybe 10 years later, the organization moved away from the homegrown application because the marketplace now had folks who actually built that technology. And so instead of us trying to upkeep the system ourselves, we were able, because as legislation changes, the rules change. You have to go back and you have to program something different in your system. You have to manage all of that. And so we decided to, instead of keeping the home built application, then we would just buy. We would get a vendor who would do it for us. But it was
Oh, wow.
very interesting times for somebody who was really more a clinical operations person,
Mm.
working with somebody who was a technology person and bringing those two brains together to build what makes sense.
Yeah.
And it worked. It really did. We had lessons from it. So
Oh, wow.
I'm going to give you a real good example here. CMS require if a patient needs to get a drug approved, you have 72 hours to get it done, or 24 hours. If you don't get it done in that amount of time, there's a penalty if you hit a certain threshold. And so we built this rule that had the queue. Obviously, the most oldest one would rise to the top, right? It get prioritized, but then it would turn red when it timed out. And so after a while, we were like, wait, it timed out and it told us that it timed out. That's not helpful. It's
Right.
already timed out. So the prior auth case would change to red 2 to 3 hours before it timed out.
Wow.
And so it would make more sense, right? You could see, oh, this one is about to time out. So this one needs to be done. Drop everything else, do this one. But
Mhm.
we were learning in real time. And so at first we were like, okay, we want to know which one's timeout, but we need to know before that happens. And we were able to reprogram. So we were doing this in real time. Guys, it was quite exciting.
Oh, wow. Yeah, no, that's I appreciate you bringing back that example to light. I just thought that was so interesting, and I love the fact that you still have the book that you had showed on the the podcast as well. I think that that's really interesting, but, one question that really comes to my mind talking about some of the leadership experience that you have, as an executive, as a board advisor. I know that recently you've became a solopreneur, for lack of better words, specifically, and I know that that's kind of 2 different worlds going from, like, an executive position into a solopreneur and a board advisor advising multiple companies in the healthcare technology space. What, I guess, what was the moment in time, like, the moment of truth that made you kind of take that leap of faith and to really to go off and start your own consulting and business overall?
I wish I could say it just happened in the blink of an eye, but what it really took was a lot of self reflection. And so I looked back at all the experience I've amassed over the last 3 decades. I was intentional about being versatile as
Yeah.
I was doing my career. So I was in pharmacy, and then I moved to do implementation in the law department, and then innovation, and then virtual care, and then health equity, and then clinical data and innovation. And so as I thought, what's the next role that I would want and where would I want it to be? I really sought out my network, people who were already in my network and people who were outside of my network. And I started talking to them. And so, as of the moment of this recording, I've
Mhm.
spoken with probably 180 people this year.
Oh,
I
wow.
reached out, I talked to people. You're one of the new people I've spoken with. And I did some soul searching. What did I actually want my next chapter to be? What skills do I have, that what value prop do I have, and who's most likely to actually want that service? And I've done a ton of work in the health payor space. I could get a job in that space if I wanted, but I figured I brought more value to other people outside of that system who need somebody who understands how to navigate through a health plan,
Mhm.
what health plans value, and what their needs are. And so when I thought through that, I'm like, there are lots of other companies I could potentially go work for. But as I did a lot of soul searching, I really realized that with the amount of expertise that I've amassed and the stage of my career where I am, I wanted to be on my own. I wanted to try doing this by myself. It's different where you're your own administrative assistant, you're your own technology person, you're your own finance person. It's very different, but it's
Yeah.
very rewarding. And so being a board advisor has been a really good experience, being able to share the experience that I have with brilliant minds out there who are coming up with technology tools to help us with the challenges we have in our health system. And I
Yeah.
can provide them the opportunity as I help them understand what payers are looking for to get that to scale so we can actually make an impact.
Yeah.
The other thing that I started working on as I thought through my own career journey
Mhm.
is how beneficial it was for me to have an executive coach. I had one for 10 years, up till up till my exit last year. I found her to be extremely helpful to me. And as I thought back on that, I thought this is an experience that I would like to be able to help walk alongside another executive.
Mhm.
And so I made the decision to take executive coaching training. And I'm currently taking your clients as part of my training,
Nice.
planning and track to be certified by the end of December
Oh,
of this.
wow.
So very excited about that as well.
Absolutely. Congratulations. So by, the end of the next couple of months here, you'll be certified at that point. Is that right?
That's right. I will be.
That is very awesome, and it's so intriguing to me your experience as a board advisor and some of the companies that you're advising as well. I've gotten the opportunity to speak with folks like Frank from Accorded specifically, but one question that comes to my mind for you is what is a big piece of advice or maybe a reoccurring theme that you see in the companies that you're on the board of now and in some of the advisory that you see, like, do you have a key piece of advice that you find yourself giving these leaders, these CEOs and these founders of these healthcare technology companies that really pushes their business forward maybe than some of the other tactics that they're deploying or kind of what they're doing in their day to day?
Yeah, there is a recurring theme. A lot of startups are health plan naive. So, like I said, they built a product, they've
Mm,
tried it outside of the healthcare system, but to get to scale, the healthcare from over 90% of you Americans is delivered through a payer. And so, if you don't understand what's important to them, you can't get in that door. Well, first of all, you have to find where the door is, and then you have to bring a solid value proposition and you have to bring a really good analysis around a return on investment. Going back to what we said about autopilot, when you bring new technology into a health plan where processes run on autopilot because people just do things a certain way, and you start trying to change that, it's going to be harder for people to begin with, right? You have
right.
to retrain people. And so when a startup is bringing something in, they have to reduce the burden to the payer.
Mm,
The burden of implementation needs to be reduced to the payer. They also need to bring a strong value proposition that has a true return on investment. And that's really critical because health plans have actuaries working for them. You mentioned Frank from Accorded. He was an actuary working at a health plan. And the actuary will think about all the things you haven't thought about. So
mm,
if you bring a technology that's going to reduce the number of times somebody goes into the hospital
mhm,
by making them stay on their medications, they go into the hospital less, but
mhm,
they're taking medication more. And the medication costs money. So what I see startups do is they'll say, we're reducing hospitalization. And they'll do a return on investment based on that.
mm.
What they won't factor into the equation is you're increasing the amount of medication this person is taking, which is a good thing. But you do need to subtract the cost of that increased use of medication from your total cost to actually have a true reflection of what you've saved. So it's I've reduced number of days you stay in bed, length of stay in the hospital. I've reduced that by 1 day or
Mhm,
2 days. And that's very expensive to be in a hospital, and
mhm.
certainly doesn't compare to the cost of drugs most times. But you do have to subtract the cost of the increased use of drug to come up with the net savings, the net reduction in cost of healthcare. And so, speaking with somebody like me, I usually bring that to their attention. If you're going to go anywhere with the health plan, that analysis is going to include an actuary. And the actuary will be looking at everything you haven't looked at, and you need to make sure you're including that in your analysis so you can show them a true net cost of healthcare savings. Very important, critical
100%.
for adoption.
Yeah, I appreciate you sharing that. And people ask me what the value is or how do I monetize my podcast? In what other world do I get to speak with folks like yourself, where you're able to share these insights, not only for me to understand, but also for my audience as well. And it's interesting to hear you talk about the value proposition that companies, healthcare technology companies, have to bring to healthcare payors specifically. Why do you think that that's a reoccurring theme that folks build solutions or they're solving problems without taking a healthcare payor? Do you see a lot of companies that are doing that, like kind of on the front end before they actually end up working with somebody like yourself that helps give them that context that they need to actually implement their solution?
When you're doing innovation, there's a balance of am I too late or am I too early? And I experienced this doing this even within the organization myself. When you have a concept and you want to test it out, sometimes it's too early to bring the operational people into the mix. It because at this point it barely is a proof of concept. It may feel like it's wasting their time because they really don't have time for that. They have a job to do. And so coming up with the initial concept, ideally, if you're going to do it right as a startup or founder, you will get people within the healthcare ecosystem to provide you input. And that could be so for example, for one of the companies that I'm board advisor for,
Mhm.
they worked on this with physicians in the health system. So the hospitals, the clinics, and so on. And that was their first market. It was physicians within the healthcare system. Hospitals
Gotcha.
again, like I said, hospitals and medical offices. And then, so they had that input, really great input, wonderful product. And then it was time for the health plan, right? So now we want the health plan to pay for this. And so that input is not there. So it's very difficult as a startup founder to get the perspectives of all different aspects of the healthcare ecosystem because there
Right.
are many. There's hospital, there's acute care, there's medical clinics, there's ambulatory service, surgical centers. There's so many different aspects. So you go to the one that you feel I'm starting here and you get input. And when it's time to scale,
Mhm.
the point of view of your next adopter may not have been embedded in your product. And so at
Mm.
that point, you can bring somebody in to help you. I can imagine as a founder too, if you have 5 different parts of the healthcare ecosystem saying, here's what you should think about here, you can't actually select a segment of the market that you want to work with. You can't solve everything for everybody all at once. And so
Yeah.
you have to stage it. I'm going to go here first. And then after I'm successful here, then I'm going to go to this place next. So I guess the simple answer to your question is it really is a balance involving people too early or too late. You want to get it just right. And that's very difficult to decipher exactly when is the right time. And even though I was not a founder, I experienced that trying to bring innovation into the organization myself because I went test it out in a pilot, and then ultimately it's going to go live somewhere else in the organization. Well,
Yeah.
the leader of that part of the organization doesn't want to get involved too much when you're piloting because they're like, well, it may not work out and I don't have time for this. And then it works out and you want to give it to them. They're like, why are you telling me now? You should have involved me earlier. Well, that's because it's successful now. If
Yeah.
it hadn't been successful, you would have felt I was wasting your time. And so it's really trying to find that right balance. And I think it's one that with time people tend to get right. But again, you have to stage this out. You can't have a product that comes out that can be used that has all the consideration of an outpatient clinic, of a hospital system, of a health plan, all of it, all at the same time. That would
Yeah.
be very challenging to achieve.
Yeah, 100%. It sounds like I could totally see why advisory is so important for some of these healthcare technology companies specifically. I think you've demonstrated a lot of your domain expertise on this podcast here. You've taught me a lot of things that I didn't know up to this point. So now I can kind of see why that journey for somebody who's founding a healthcare technology company is so complex. Thinking, for folks that don't have a clinical background that are starting a healthcare technology company, from talking with people like Dr. Lazardo, people like Calvin at Vital IO, they talk a lot about how relationships are so important in bringing adoption and kind of meeting the right people is from like a marketing perspective and to increase adoption for a lot of these healthcare technology startups. Do you have any strategies or advice that you can give maybe a new founder or a CEO in how to establish the right relationships with the right people? And I know it depends from company to company, but are there any like key principles or frameworks that you use from the advisory that you give to these companies that might be able to help somebody from our audience?
Yes. So the network is very important. That expression that your network is your net worth is really,
Yeah.
I love when I heard that and I keep it in mind a lot of the time. So your network is important. And it's important to figure out exactly where you want to start in your stepwise approach
Mm.
and make sure you have the right people engaged to have that conversation. Ramon Lazaro introduced you to me and me to you,
Mhm.
that's part of his network, right?
Right.
So you can tap into your network and get people's input. So right now, I'm working as strategic advisor for another startup. They want perspectives from 5 different ecosystems. So it's getting in the door, especially for health plans where everybody's so busy And
Mm,
I don't know if you've seen, the healthcare news lately, but we're expecting the cost of health insurance to go up significantly.
mm,
Not only for people who are on the marketplace or the exchange, but also for folks who have commercial insurance. And so health plans are doing their best to try and keep costs down as much as possible. And so being asked to do more with less, which
yeah.
means you have less people who have the capacity to take on something new. So coming in the door, folks don't have time to talk to you. If you find people who have relationships already, like people like myself who've been in the health plan world for more than 20 years, they can get you in the door. But when you walk in that door, you have to be ready
Yeah.
because they don't have time. They
Right.
have already doing 3 jobs
Yeah.
and they have a mandate to reduce costs.
Yeah.
And you can't reduce costs and deny care inappropriately. So
Mm.
you want to keep the healthcare quality, you want to keep access, you want to keep the experience good, and you also want to keep costs down. And that's a very challenging balance.
Yeah, and that's where the advisory comes in. And for any founders or CEOs in the healthcare technology space that want to network and talk to folks like yourself, are you open to companies reaching out to you? I'm sure that you probably get a lot of people reaching out to you probably all the time for advisory specifically. But is there any like specific types of companies that you're looking to advise kind of going into the future, maybe the next 12 to 24 months?
Yes, yes. So I have certain pillars that I'm really interested in. So one of them
Nice.
is emergency room diversion. Makes sense because
Oh,
I work with Dr. Lizardo and
yeah.
Tele 911. So ER diversion is certainly something that's very interesting to me. Women's health, certainly
Mm,
something I'm interested in as well. Pharmacy,
mm,
for sure, with my deep pharmacy expertise.
yeah.
Pharmacy costs are the driver for increase in healthcare costs. They
Mm.
are the number one driver for that. So I have a lot of expertise in that and always very interested to talk to folks in the pharmacy space.
Yeah, 100%. So it sounds like the companies you're interested right now are ER diversion companies, pharmacies, and women health companies as well. So I think that that's interesting. I'll keep my eye out for any folks that I come across in my network. I'm happy to connect them with you. But yeah, now I'd love to transition the podcast into a lot of the thought leadership that you're doing specifically. I know last time we talked, I mentioned that I've been with my girlfriend now for over 10 years now up to this point. And so it's a true honor to be able to bring women who are powerful leaders such as yourself on our podcast. I don't get a lot of opportunities to speak with folks like that. And so a lot of these insights, I'm really excited for her to be able to consume and to watch just from a business standpoint as well. But I know that you're going to be writing a book and coming out with it. I don't know how soon exactly that is, but I'd love to highlight that on our podcast. I think that it's something that's really intriguing to me, and I know it's got a lot to do with your personal journey up to this point in your life. And so could you maybe share some insights into what your new book will kind of be about and maybe like a timeline when folks can kind of expect to get it?
Yeah, so it's looking like it's going to be 2027 because
Nice.
I loaded my plate with a lot of things this year. I thought, who knew taking a year off work was going to be so busy? But I appreciate that. And it really, like you said, it's about my journey, 3 countries, 3 continents, and a career that has transversed pharmacy and innovation and compliance and operations and all that. Interwoven into that is my intersectionalities. And that's the other thing I really do want to mention here is, it's harder when you're a woman to raise money, to run a business, to lead teams, because women are supposed to be likable and we're supposed to be nice and we're not supposed to be tough and we're not supposed to ask people to get things done and we're not supposed to be hard drivers. And so women leaders have to really balance likability with the ability to get things done. So that's one thing. And then if you add on top of that I'm a woman of color, being a Black woman, that actually adds another intersectionality into my experiences. Not only am I a woman, I'm also a Black woman. And when we add to that, we add in my immigration status. I'm a naturalized American citizen, but like I said, I have a mixed background and I have an accent, though people half the time can't tell where it's from, but
Yeah.
it's there. And so when you add all three of those together, you're navigating in spaces that are just a little bit different. So for
Yeah.
me, I hold a British passport, I hold an American passport. My formative years were in Nigeria. I'm not British enough, I'm not Nigerian enough, and I'm not American enough. And so I have to find the space where I feel like I fit the most. And sometimes when you don't find that space, you just go out there and you create it. And that's
Mm,
exactly what I've done by
I love
setting
that.
up a nonprofit,
Mm,
which is looking to help galvanize or accelerate the professional development of immigrant and first generation women, folks who are bringing in different mixed cultures and backgrounds, but still want to drive their careers and get ahead in a professional corporate space. And I
yeah.
want to really share my learnings and that of other people in my network to help lift up this new generation.
Yeah, I love that. I mean, I can feel your energy through this podcast here. I know how passionate you are about that. And I think that I'd agree with you as well. You know, women coming from non-traditional backgrounds, the only way for them to redefine leadership is to create their own space where they fit in. And I think that you're a living example of that. And you just show people kind of what's possible. That's why I'm excited for you to continue contributing to thought leadership, not only on LinkedIn, but also for you to come out with your book in 2027. I know it's a while out, but maybe closer to the release date, we can bring you back on the
That would
podcast.
be awesome. It takes a while to get a book done. There's so many steps and learning about all the steps it takes to write, to publish,
Yeah,
to do all the marketing associated with it. So I'm looking forward to really picking that up. 4 chapters are already written. I expect it to be 9 to 10 chapters
nice.
and picking it up again next year and going to publication in 7. And
Yeah,
I'd love to come back.
I appreciate it, and I love to get access to that book as well, and maybe to help with your marketing efforts and to bring a little bit more awareness. Maybe you know, if you're open to it, we could share a teaser on this podcast here. You had told me the story of having two different birth certificates, and it's one of the key stories in your book. I don't know if that's giving away too much secret sauce, but is that something that maybe we could cover on the podcast here?
Maybe we cover that on another podcast.
There we go.
Closer to release date. Yes.
Absolutely. I'll make sure to note that down. But Jackie, no, I just wanted to tell you thank you so much for your time and for coming on our podcast and sharing all of your insights today. I'm sure any folks in the healthcare technology space that watch our podcast, I'm sure they're going to have questions to you. And so, as you mentioned, you know, is LinkedIn really the best place for people to go reach out and to connect with you?
Yes, but LinkedIn is the right place to get a hold of me. I'm active on LinkedIn and responsive. I don't tend to ghost people, so always willing to speak with startup founders who have technology, and that is what I do for a living. So I'm excited to talk to folks, and I learn a lot from them as they learn from me. And the other thing that I should have mentioned earlier is care navigation. That is a big space. If you're a founder out there and you are putting something together to help with care navigation,
Mhm.
everybody's had this experience before. You go see your primary care doctor, they refer you to go see a specialist. You call the specialist, they're waiting for the referral, you're trying to get the appointment, they asked you to go get an x-ray or an ultrasound, and you're trying to coordinate all these pieces. A lot of care gets dropped in that process.
Right.
And CAD navigation that can leverage AI and all the other technology there to connect the dots, get the referral, set up the appointment, get it all done. Oh my God, that will be awesome to
Yeah.
have. And I've spoken with a few CEOs of regional health plans, regional blue plan. As we were chatting, he and I said the exact same thing at the same time. Like, oh my God, if we could just have that. So
Oh
if
well.
you're out there and you are working on a tool that's leveraging AI or whatever technology you're leveraging to help to take the noise and the frustration about coordinating care, I'd love to speak with you.
Yeah, no, absolutely. And I know I've got first access to that with this podcast here before we publish it. So if anybody doesn't beat me to it, then no, I'm just kidding. But yeah, I think that that's a really interesting area of focus. I hadn't heard about that before, but I appreciate you sharing that on our podcast. And really, before we wrap up here, Jackie, is there anything that you want to leave the audience with, whether that's my audience or whether that's your audience and the folks that you're looking to impact? With like, founders, CEOs of healthcare technology companies, or even women in leadership positions as well. Is there any key themes that you want to leave the audience with kind of as we wrap up?
Yeah, let's stick with women in leadership. I know it's challenging, but we are 51% of the population. And I believe we have a responsibility, as well as our male peers, to be supportive and to be allies. And so I was chatting with a gentleman at the airport as I was boarding my flight back from a speaking engagement in Vegas last week. And he said he was in New Orleans and he went there as a security company. And he asked me what I was doing. And I said I was just on a panel talking about career career wrongs and growing your career and how challenging it can be. And he said to me, I said, because you know it's difficult, more difficult for women. And he said, right there, stranger, don't know him from anywhere. He said, you are absolutely right. It is much more difficult for women. And he said, I try to be as supportive as I can. So I guess it's a call out to the women to continue to encourage as we are growing in our career and our leadership. And it's a shout out to the men to also be an allies and to have awareness that it can be more challenging when you're a woman in leadership. And
Yeah.
so be an ally, speak up when the woman is being spoken over,
Mhm.
speak up when somebody else is stealing her ideas or people are not acknowledging that she actually just said that and somebody else repeated it and that new person gets credit for it. Speak up and just remind folks, you know what? Thank you for repeating what, Janet just said.
Yeah.
Yeah, thank you for repeating that so people can realize that she actually said that, but everybody glossed over it. So women, continue to fight the good fight, and we need you in leadership, and men continue to be allies.
100%. I absolutely love that advice. I couldn't have said it better myself. And I'll know, in the initiatives that I'm doing, even though it's slightly outside of healthcare, I'll do my part as far as making sure that I highlight key voices, women who are in leadership specifically that have innovative ideas. Oftentimes I joke with my girlfriend that she's smarter than me and in the way that she thinks about certain things. But I just, I can't help myself to say, I think, we're so grateful to have people like you, Jackie, that are out there that are leveraging your over 30 years of experience in business, as an executive, and now what you're doing now with advisory, coming on to folks like myself and my podcast and sharing some of the insights that you have. So I'd encourage anybody in the audience, if you have any questions, definitely feel free to comment on this video. If you see it on YouTube, feel free to comment if you see our posts on LinkedIn as well. And as Jackie mentioned, we would love to have her back on the podcast. But really, other than that, guys, let us know if you have any questions, and we'll catch you in the next video.